Hi, my name is Kristen Maloney, and this is my presentation for HCIN 552 for Module 1 on disaster preparedness in the EHR era. So, in the wake of the Hurricane Katrina crisis, an estimated 400,000 medical records were lost. Many evacuees forgot to record their medications or they misplaced a list of medications. Some did not remember all of them. And so, with no access to these records, the evacuees' doctors had no way of confirming what medications they had, immunizations, test results, and other past medical history. So Katrina hurt the most vulnerable, impoverished areas as well of the South, including New Orleans and parts of Mississippi and Alabama, and has been called the worst disaster in U.S. history. The hurricane exposed the weaknesses on our reliance on paper records and impacted so many aspects of healthcare delivery and public health due to lack of preparedness and lack of digital health data. So, since 2009, with the HITECH Act mandating the adoption of EHRs, we live in a different world than we did in 2005 during Katrina. For healthcare quality, safety, efficiency, and data privacy under HIPAA, a huge wave of adoption of EHRs occurred in the late 2000s and into the 2010s. According to the ONC, Office of National Coordinator, per healthit.gov, as of 2021, nearly 4 in 5 office-based physicians and nearly all non-federal acute care hospitals adopted a certified EHR. So EHRs have now been in wide use for over a decade and provide a slew of benefits that can help arm healthcare organizations against the devastating effects that occurred in disaster situations like Katrina. Organizations can be better prepared today than they were historically as well, due to the presence of EHR and IT security capabilities to arm themselves. And they must also continue to adhere to operational preparedness measures to be prepared across the board, in addition to the benefits of the EHR in disaster preparedness. And an example of this would be the CMS Emergency Preparedness Rule and also cybersecurity disaster planning. So, organizations need to prepare for biothreats, natural disasters, safety threats such as gun violence. And this does look differently in the era of EHRs than it did 18 years ago when Katrina hit. The EHR increasingly supports interoperability, although this is not perfect, still needs improvement. And it enables a range of other tools and technology that can be used to track and monitor patients and monitor public health, help deliver care, and analyze data in real time. This infographic from Select Hub highlights some of the current and emerging trends, many of which can benefit healthcare organizations in their preparedness and response and recovery from a disaster or public health emergency. So, in terms of preparedness, here's what organizations can and should do. Practice EHR data should be securely, regularly backed up off premise or to a cloud based storage. In the event of a disaster, patient records can be accessed digitally via many locations and by more than one user at once. And staff can use EHRs to facilitate patient handoffs and triage. The EHR also enables data to be backed up and securely available and accessible whenever needed to resume care for patients after the event. And it enables contribution of data to public reporting and to centralized data repositories such as health information exchanges and maybe other reporting needs as the disaster warrants. And as mandated in the privacy rule, practices should be utilizing all appropriate technical, physical, and administrative safeguards to secure and protect each PHI. So they should already have implemented device security policies and infrastructure to achieve all this already. But it is an important part of preparedness. And then I did briefly mention also the idea of operational preparedness, which doesn't directly pertain to the EHR itself, but is an important part of disaster preparedness. And the example I gave was the CMS emergency preparedness rule, which requires practices to perform a risk assessment to determine what hazards are most likely in their area, and to build a communication plan to have a system to connect with staff, providers, and other key contacts, and as well as coordinate with state and local public health departments and emergency management agencies. And of course, they need to have policies and procedures in place for to set overarching guidelines and organize their plan. And they should be have a training program for employees and undergo stress testing to ensure or drills to ensure that they're prepared. So organizations can adhere to these through the development of an annual review of a disaster preparedness plan, and this can help practices ensure that they have the preparations needed. They should also think about special patient triage plans, maybe evacuation plans, and specifically having emergency equipment such as backup electricity generators, and that can all be part of their disaster preparedness plan. And then they should also consider identifying a backup location or partner facility that can take their patients in the event of a disaster, especially if it's a hospital-based practice that has inpatient services. And so, for responding to a disaster, certainly EHRs help ensure that PHI can be secured and protected and still accessed and used ongoing in the coordination and delivery of patient care. And, again, as I mentioned before, practices should make sure that PHI should be securely backed up and accessible in the event of disaster. The disaster plan can dictate what threshold the facility should be locked down and secured, at which point sensitive areas, equipment, and devices which access data could be secured in accordance with their protocol. Organizations may consider rapidly rolling out or standing up new data sharing mechanisms to quickly and securely share data needed for the response and to make patient records available in other facilities. And then also, finally, the response would be, it would dictate that they would be deploying their communication plan, and they would also have some sort of a staffing plan in their disaster preparedness plan that would allow them to ensure that they have adequate staff to respond to the emergency in a situation where they need to scale up their staffing capability. So EHRs really do allow practices also to potentially recover from a disaster through deployment of a data recovery plan and their disaster preparedness plan. And of course, the data recovery plan requires system security and backup to be in place, but it is something that they could execute since the EHR would enable, the ability to re-access data either from off-site or an alternative site, and also allows them to share and exchange data, as I previously mentioned. And organizations should continue to report data and monitor, and they can utilize this data to learn from the public health impacts of a disaster as well. And of course, recovery should include the continued communications. It can also include things like support services and assistance for patients and staff. And it's a time for the organization to evaluate and replace any equipment and assess where and how normal operations can potentially be resumed, if at all, or how to refer patients out to another site. And then, of course, personnel impacts are important as well, including trauma and grief counseling for staff if needed. So in my research, I used resources from CMS, the Journal of HCIN, as well as some lessons learned from Katrina Health and a blog from ONC on disaster planning. So here are my references. And with that, I would just basically close, say thank you, and appreciate you listening. I hope you've taken away that EHRs position us to build more resilience in the face of disasters through being able to access and share data and continue to care for patients, but only if we're properly prepared. Thank you.